Hi, Dr. Hagmeyer here, and I'm the clinic director here at drhagmeyer.com, where we help people from all over the world find answers and solutions to problems that they've suffered with for years. While I don't know the exact reason that you or a loved one is interested in the comprehensive digestive stool analysis, I'm going to assume that you're struggling with some sort of health problem that stems either directly or indirectly from gut health. And you're searching for answers to those problems. Well, the best way and the best method to start finding those answers that you're looking for starts with the right kinds of testing. It's impossible to fix something if you don't know what's causing it. And when it comes to gut health, this is not something you want to be guessing about. In today's video, I'm going to explain a bit more about the comprehensive digestive stool analysis, why it's important, the kinds of problems that this test can help sort out, and really why this test is so helpful in understanding how to support and fix your gut health. All right? There's so much more to fixing the gut than simply just taking probiotics. Obviously probiotics are very important, but I think what has happened is that people just think that if they just take a probiotic, that everything's going to be okay. And that's not necessarily the case. There are many, many problems that are causing gastrointestinal issues. And again, that's why testing becomes so important. You see, gastrointestinal complaints, they're the most common reason that patients seek medical care. But unfortunately, most patients that suffer with chronic gastrointestinal problems go to the GI doctor for a stool test or an endoscopy, and that's really the end of the road for these people. There's not a whole lot more that your doctor can do or tell you based on the tests that they've run. Maybe they can prescribe antibiotics, maybe they can prescribe, antifungals, maybe they can put you on steroids, creams and things like that. But that's exactly where this test begins filling in those gaps. While a standard test can identify an infection with things like H. pylori or a parasite or some other kind of bacteria, that's really all these tests are really good for. The standard testing does not help uncover all of the reasons why someone struggles and suffers with gastrointestinal issues. And unfortunately, for this reason, hundreds, if not thousands of people will continue to suffer, sometimes their entire life, without getting answers to their GI problems. If you're someone who's already had a colonoscopy and you still struggle with IBS or IBD, the Comprehensive Digestive Stool Analysis not only provides information that standard stool tests provide, but it goes a step further in that it provides a detailed information on the health and the integrity of the gut, as well as how to support things like digestion for optimal microbial health. There are many, many things that I like about this test, right? Number one is that it's accurate. That's number one, really. What good is a test if it's not accurate? So that's the first thing that I always look for when I choose tests to provide to my patients. Number two is that the CDSA, or the Comprehensive Digestive Stool Analysis, it's a simple stool test that can be done at home. This means that you don't have to schedule an appointment to go into a doctor's office. You don't have to sit around all morning. You don't have to take off from work. So it's going to save you time. It's going to save you money in that respect. Number three is, the other thing I like about this test is that it helps assess several areas of function, or more importantly, I should say dysfunction in the gut. Let's take, for example, something like a gastrointestinal problem that's rooted in poor digestion, right? This test helps us understand how well you're digesting, how well you're absorbing foods. Various enzymes and immune system markers are part of this understanding. And it might explain, for example, why you're having mushy stool, or why your stool is frequently loose, or perhaps maybe why your stool is floating, or why you're constipated, or why you're bloated all the time, right? Why you have these ongoing nutritional deficiencies. This test also tells me about the health and the integrity of the microbiome. This is where tons of research is being done, in the last 5 or 10 years. What kind of bacterial species are populating your gut? We know that, again, different strains of bacteria are responsible for different aspects of our health. Sometimes it's not what's living in our gut, but sometimes it's what's not living there. And again, that test can help us understand that. We refer to this as gut dysbiosis, and this gut dysbiosis has been shown to cause things like anxiety, depression. We know that the microbiome of the gut also plays a role in the conversion of thyroid hormones. We know that various cardiometabolic issues stem from gut dysbiosis. We know that blood sugar stability stems from gut dysbiosis. We know that things like brain fog and fatigue. We know that chronic pain, musculoskeletal issues. I mean, the list goes on and on about the different health problems and the ailments that are tied into the gut. This test also obviously evaluates for things like parasites. What kind of parasites? It's very, very comprehensive in terms of the kinds of parasites and yeast that it can detect. The other thing here that I like about this test is that it shows us, based on the species that's found, it also shows us what's going to be the most effective remedy for that overgrowth. It assesses the pH of the stool. It looks at things like bile acids. That becomes important, especially when dealing with patients that have bile acid malabsorption, right? That's where we see a lot of chronic diarrhea. It reports traces of blood in the stool. It also shows us if you have low levels of pancreatic enzymes. Now, pancreatic enzymes are important because this can be the culprit behind things like acid reflux. It might be the culprit behind bloating or constipation or diarrhea. The other thing that this test looks at is a variety of different inflammatory and immune markers. This is very, very important because we know that there is an inflammatory, or there's a neuroinflammatory connection between inflammation in the gut and inflammation in the brain. So this could be especially important for those individuals who suffer and struggle with neurodegenerative diseases or maybe even mental health problems. This, again, is not found in traditional stool testing, right? The degree of information that can be pulled from a test like this doesn't compare to the standard stool testing. So what I always tell patients is that traditional stool testing doesn't make the grade and only provides information for most of your acute infections, right? So with this being said, why should somebody consider purchasing this test and a consultation? Well, let me give you some of the obvious reasons and then, of course, the not so obvious reasons for this test, right? Number one, gastrointestinal problems. These are the obvious ones, right? If you're someone who has struggled with gastrointestinal problems for more than 3 months, you should get this test done and get this consult. If you've had a colonoscopy and let's say the colonoscopy was normal, but you still suffer with GI symptoms, right? Again, I recommend that you get this test and consult. I also recommend this test for patients, really for any patient for that matter, who has an inflammatory bowel disorder. Maybe they have Crohn's disease, maybe they have ulcerative colitis or pancolitis. Maybe they have SIBO, small intestinal bacterial overgrowth. Maybe they have a leaky gut. Or perhaps patients who've traveled to foreign countries and maybe their GI system worked perfectly before going on a trip. And when they've returned, now they're having all these unusual IBS symptoms, right? So again, if you're finding that you're someone who's reacting to foods that you, once upon a time, you never reacted to, that's a good reason, right? You're becoming more sensitive to foods, right? Every time you try something new, you're starting to have bloating and constipation and gas and so forth, right? Those are all really, really good reasons. The Comprehensive Digestive Stool Analysis, also, there are not so obvious reasons, I should say, when it comes to testing. And again, let's talk a little bit about those. These might be things like autoimmune diseases, right? If you're a person who has, let's say, Hashimoto's disease, which is a thyroid disorder, if you have Graves' disease, if you have lupus, if you have celiac disease, if you have diabetes, or really, if you have any other kind of autoimmune disease, then I recommend this test. And while you might not make the initial association between testing, doing a stool test and immune system health, it's important to know that 80% of your immune system is in your gut. And so a bad gut is a bad immune system, right? Number 3 is inflammation, right? This may be the kind of inflammation we see in people that, let's say, have chronic migraines, or they have headaches on a regular basis, or maybe this is the person with metabolic syndrome, or syndrome X, or maybe it's a person with heart disease. Maybe it's a person who's inflamed and it's causing fibromyalgia or rheumatoid arthritis, again, or any other kind of inflammatory joint disorder that's not caused by, let's say, a direct trauma to that joint. All right. Another common scenario in terms of why I think this test can be very helpful is when dealing with skin conditions, right? Maybe you have, a child at home, or there's a young adult at home and they're struggling with ongoing acne, or you're an adult and you suffer with rosacea, or you struggle with psoriasis or eczema. If a skin condition has developed, it most likely has connections to gut function. And again, this is why I think that's so important. Another common scenario for running this test is nutritional deficiencies, right? If you're having a tough time with iron levels coming up, they're always low, your ferritin levels are always low, or maybe you've had a history of getting B12 shots, and after a couple months, your B12 levels are low again, you're finding yourself tired and run down. That's another good scenario. Another scenario where I think about running this test is with people who have depression or anxiety, or someone who suffers with ADHD or autism, or any person along the spectrum of autism. Again, mental illnesses. This is, again, a brain-gut connection that we are seeing over and over and over again. So if you said yes to any of these, then I recommend investigating the health of your gut. Again, because there's a strong connection between gut inflammation and gut dysbiosis and brain inflammation. So remember this, you can't fix what you don't know, and this test takes out the guesswork in terms of what's going on. It'll help you feel so much better knowing where your problems are originating from. And also, most importantly, it'll give me an understanding of really where we can best support your gut. So there you go. Those are some of the reasons that I recommend purchasing a comprehensive digestive stool analysis and consult. I'm Dr. Hagmeyer. Take care.